Good morning and welcome to the webinar, Mental Health and Burnout, an overall state of the union and impact across all age groups, presented by the Greater Miami Chamber of Commerce Healthcare Committee. My name is Brian Stewart and I serve as the chairman of the Healthcare Committee. And my day job, I serve as president of Miami-Dade College Medical Campus. I want to thank our sponsors today, Nicholas Children's Health System, and give a shout out to the team members representing Nicholas Children's Health System with us today. We have a very impressive and distinguished panel of healthcare experts with us here today to talk about what unfortunately has become an alarming healthcare and business issue across all age groups. We continue to live and experience unprecedented times. Before turning over the program, I want to run through a few logistics of how we'll run things today. Then we'll give our sponsor an opportunity and show a video from Nicholas Children's Health. On webinar logistics, your microphones will be muted. Please use the chat box for comments, next working, and exchange of ideas and sharing of information. If you have questions for one of our speakers, please make sure you use the Q&A feature, not the chat box, and I will be fielding those questions from the Q&A box toward the end of our session to our speakers. The webinar is also being recorded and will be available on the Chamber website later today. Also, we will drop in the chat information on nominations for our Healthcare Heroes Award, which deadline will be on December 19th. So please consider nominations for our Healthcare Heroes Awards. And then if you have any questions, please contact Tanya with the Chamber and she'll be able to answer anything you might have. So now for our sponsors' remarks. It wouldn't be possible to have events like this without our great sponsor. So thank you, Nicholas Children's Health System, for being with us today. And here's a video. Let's roll the video.
Hi, I'm Maya. I'm so happy you could join me today. I will be your host for today's tour of one of my favorite places in the whole world. Nicholas Children's Hospital sees nearly 250,000 patients a year as the premier provider of all things health for kids like me in South Florida. We even serve kids from over 100 countries around the world too. Our hospital is the only freestanding pediatric hospital in the region. If you've lived here in South Florida a while, you might know us by our previous names, Miami Children's or Variety Children's. The hospital just celebrated its 70th birthday. Can you believe it? 70 years? And today we are called Nicholas Children's in honor of a $60 million donation from the Nicholas Children's Healthcare Foundation, established by longtime supporters Jack and Barbara Nicholas. How cool is that? Our emergency department alone is one of the most visited ERs in the nation, seeing 90,000 patients a year. Other hospitals send really sick kids to our intensive care unit so they can get the very best care. The LifeFlight Critical Care Transport Team brings about 4,000 children here, either by ambulance, helicopter, or even a fixed-wing airplane. Once they get here, these kids are in good hands.
Here at the Nicholas Children's Spine Center, we see thousands of patients a year who come to us with potential spine problems. Diagnosis usually starts with evaluation and our low-dose EOS machine to help us figure exactly what's going on with the patient. We do several hundred surgeries a year with our goal to get the patient back to doing exactly what they love.
Wow, thanks for the info, Doc. I gotta run now. I'm late for meeting some of my best friends in the whole world.
Maya!
Hey guys!
Maya!
I was just bragging to my new friends a moment ago about you guys. When I was 9 years old, I was diagnosed with a really rare type of bone cancer, osteosarcoma. And ever since, I've been treated right here at Nicholas Children's Hospital. I can't begin to express the love I have for the doctors and nurses and everyone here at Nicholas Children's, who's always went above and beyond for me and my family. From all the kids at Nicholas Children's, thank you for making a difference. Bye!
Thank you, Nicholas Children's Health System, for that excellent video. It is now my pleasure to introduce to you my Vice Chair of the Chamber's Healthcare Committee, Dr. Aneta Rodon. Dr. Rodon is the Chief Executive Officer for FIU Healthcare Network. In this role, Dr. Rodon leads the clinical enterprises that serve the Academic Health Center, FIU campus, and the community. In addition to the CEO role, Dr. Rodon serves as the Associate Dean for International Affairs for the Herbert Weiss College of Medicine. Dr. Rodon is the immediate past Chief Executive Officer and President for Jackson Health System. Her training as a medical doctor has taken her as a student, educator, and speaker across areas in the Caribbean, Central and South America, and Asia. Graduating with highest honors, in addition to her medical degree, postgraduate and fellowship training at the University of Miami Jackson Health Memorial Hospital and affiliates, she holds a master's in public health and a master's of business administration from the University of South Florida and the Haslam School of Business at the University of Tennessee, respectively. She is an alumni of the General Management Program at the University of Pennsylvania Wharton School of Business. It's my pleasure to introduce my partner in crime, Dr. Rodon. The floor is yours.
Thank you, Dr. Brian, and good morning all, and happy holidays to you and your family. It is truly a pleasure to be here with you once again and to really offer a very, very important topic that I believe has been in the minds of so many, not just because of COVID, but it's been in the minds of all of us that day to day we see loved ones, friends, etc., suffer from mental health. Just to begin to, just to frame today's talk, I just want to provide you with some stats, both locally, both throughout the U.S. as well as globally. 1 in 5 Americans live with a mental health condition. 1 in every 20 Americans live with a serious mental health condition like schizophrenia, bipolar disorder, or long-term recurring major depression. 50% of all lifetime mental illness begins by age 14, and 75% begin by age 24. As we look at the global impact of mental illness, we find that the anxiety, depression, alcohol use disorder, bipolar disorder, schizophrenia, they affect millions and millions of people globally. As people grapple with these health, social, and economic impacts, mental health has been widely affected. Plenty of us became more anxious, but for some, COVID-19 has sparked or amplified much more serious mental health problems. A great number of people have reported psychological distress and symptoms of depression, anxiety, or post-traumatic stress. And there has been worrying globally of widespread suicidal thoughts and behaviors among healthcare workers. Today, we are honored to welcome two experts in the field of mental health, Dr. Tawfik from Nicholas Children and Dr. Roth, a dear colleague, friend from FIU. I will be brief in their respective intros. Their bios are very extensive. You will find them in a link, and I will try my best to highlight their great achievements in this very important area. I will start with Dr. Roth. Dr. Roth is a professor for psychiatry and behavioral health at the Herbert Wertheim College of Medicine, Florida International University. He is a founding faculty member and founder and director of the Medical Professionalism course, which prepares students for the intense psychological experiences of becoming a doctor. Dr. Roth also serves as assistant clinical director for the medical student psychiatry rotation. And in addition, he holds adjunct academic appointments and collaborates in research with the Stemple College of Public Health and Social Work, the Latin America and Caribbean Center, and the Cuban Research Institute at FIU. Dr. Roth is an internationally and renowned expert on the mental health of immigrants, refugees, and minority populations. He is trained in adult, adolescent, child, and forensic psychiatry and psychoanalysis. Welcome, Dr. Roth.
Thank you.
Our other speaker and panelist is Dr. Sanaya Tawfik. She is the Director of Assessment, Associate Director of Psychology Training at Nicholas Children's Health System. She is also a Clinical Associate Professor and Community Faculty in the Department of Psychiatry and Behavioral Health at the Herbert Wertheim College of Medicine, Florida International University. Dr. Tawfik completed a pre-doctoral internship at Harvard Medical School, Boston Children's Hospital, Judge Baker Children's Center, and she remained in Boston to pursue a postdoctoral fellowship in pediatric psychology and behavioral medicine at Harvard Medical School, Boston Children's Hospital. She has more than 25 years of treating children and adolescents with intellectual disability, as well as with social emotional difficulties. Please join us in welcoming our two experts, panelists this morning. Just before we start, I would like to give you just a rundown of the format. We will have a presentation by each of our speakers this morning. Then I will go into a brief session of Q&A with both our speakers, and then we will open up for a Q&A with the help of Dr. Stewart for those that are participating this morning. Again, I want to thank you, and I'm sure that you will enjoy this morning's presentation. Very timely topic, and more importantly, especially with everything that we have gone in our world in the past 2 years and as we enter the holidays. So Dr. Roth, the floor is yours.
Thank you very much, Dr. Roldan. Thank you for the honor of being able to present to this group. I'm going to share my slides. So there's a lot to say from a psychological viewpoint regarding COVID, but some people have been traumatized by it. And we begin by looking at what are the characteristics of COVID trauma. First of all, the threat that came upon us suddenly was invisible. It could come from anywhere. So in a way, it's similar to terrorism, where terrorism attacks comes from nowhere and it's unannounced, sudden and unexpected. A lot of unknowns in the beginning. We didn't know how contagious it was, how lethal it was. There were a lot of rumors and misinformation, and some people died and not others, creating uncertainty and panic. And there was also a lot of misinformation about the vaccine, which created even more uncertainty. So what ended up happening was a lot of social isolation. Now, social isolation also causes separation from loved ones. For children, it was grandparents, even people who were sick and at the end of their life, we could not reach out to. Loss of routines, very disorienting for children who did not attend school, and loss of income. Many places went out of business. Also loneliness. Here you see a picture of a cell where the prisoner would be left alone. And children, you see that sending a kid to their room is a form of punishment. So loneliness is something that is not part of our human nature. We're not wired to be alone. This is a very important concept. We lost the illusion of safety. The illusion of safety is a defense mechanism that happens in all of us. When we get on the highway in our car, we cannot think about being run over by a 18-wheeler, 16-wheeler truck because we wouldn't be able to concentrate on the driving. So we have to block all that and think about having an illusion of safety. But when something hits us very close and we feel vulnerable, we lose that illusion of safety, and it leaves us feeling very vulnerable. There were losses of farewell rituals. There are 3 universal funeral rituals that are present in every culture and in every part of the world. When a person dies, there's the presence of the body, sometimes the presence of an urn or a photograph. There's a eulogy where we remember the departed so that we can remember the stories and they will continue living in our memory. And the third thing is that family and community gather to support the bereaved. So one of the people who passed away during COVID was my primary care physician, and up to this day, there has really not been an official funeral for him. I'm going to move very quickly. Hans Selye was a Hungarian-American professor of medicine who talked about the stress response and how our body slowly adapts to stress. When there's an alarm state, it creates a type of storm in the systems that connect with each other, that is the endocrine, the cardiac, and all the immune system. So there's a disruption to the body. And this may create trauma. There's 2 types of trauma: single event and complex prolonged trauma. So when we look at single event, is one single event like witnessing a car accident when somebody died. A complex ongoing trauma is long-standing. So what we see with COVID is that this was a type 2 sustained long-term trauma, which causes more damage than single event trauma. And this causes an adjustment. It could be with depressed mood, with anxiety, with mixed anxiety or depression. In children, we see a lot of disturbance of conduct and emotions. And what happens with the human stress response is that if we stress the body for a long enough time, the neuroendocrine and immune system changes become permanent. And in the long term, people end up with things like obesity, high blood pressure, hypothyroidism, cardiovascular disease, premature aging. And I'm going to say something about premature aging. Stress causes premature aging, and all you have to do is look at American presidents before they start their term, and 4 years later, American presidents look like they've aged 15 years. So it's a very high stress job. Very quickly, treatment and recovery. So what's important for treatment and recovery? We have to consider the stages of grief. We have a system embedded in our bodies, in our brains, where we go through the stages of grief: denial, anger, bargaining, depression, acceptance. The stages of grief do not follow an organized order. Maybe they jump back and forth sometimes, but it's very important to go through the grief. And why are we going through grief? Because we have to evaluate what was lost, our routines, friends, the way that things used to be. Then questions come up with grieving. How did this happen? Why did it happen? Could it have been prevented? How to build new lives, etc. And what we do for our patients is we do not impose meaning, but we help the patient find their own meaning in the tragedy, in the trauma, because trauma, tragedy, and mishaps always invite us to find new meaning to our lives. So sometimes enforced confinement can be a positive thing. Many people who are put in prison have a renewal of their spirituality. They find new meanings in life. So sometimes being alone invites us to self-analyze, to reevaluate our lives as a whole, and to find new meaning and a new future. The capacity to be alone is a capacity that not everybody has, and there's a long psychiatric literature about how the capacity to be alone has to do with having had good parenting. If we had good, loving parents, we are able to be alone. People who didn't have good parenting have a lot of difficulty being alone. They often feel abandoned, anxious, scared of being alone. So being alone was one of the results of COVID. And one of the things that happens when we're alone is that there can be distortions in the perception of time. If we're going through a painful period, the time can be unbearably prolonged. Like when you go to the dentist and they're drilling on your teeth, the time is unbearably prolonged. Other times when you're having fun, the time looks like it's a lot shorter. So when mourning is involved, mourning is a painful process. So mourning often seems like it's going on forever. Finally, psychotherapy, talking therapy, what we look at is the trauma is like the life story of a person being severed. So when we do talking therapy, it's like life story repair. We create a new narrative that is dynamic, coherent, and meaningful, and it takes us in new optimistic directions. And we end up asking, how do we, how are we here? How did we get here? Where are we going? And we shape our lives in a more meaningful way. And for some people, transcendence and spirituality may also lead to a redefinition of our lives, new priorities. We change our values. We question what is really important in our lives, and then we move on. Because tragedy often engenders empathy. We become more compassionate and more understanding of others, and we evaluate our life in its entirety, and we value and live the moment more intensely. Thank you very much. There are some references. If you're interested in reading more about this, I'd be glad to send you the articles. Thank you very much.
Dr. Roth, excellent, excellent presentation. Like I said, this is just a taste. We're sorry we have to put it such a short. There's a wealth of information, and not only your experience that you're bringing here this morning, but also a wealth of information that basically touches and have touched each of our lives throughout not just COVID, but through traumas. Great. I have great questions for you, especially love the fact that you touch upon the family structure. More to come to that. So thank you very much. And now we will welcome Dr. Tawfik for her to give her presentation, focus more on children and adolescents. Dr. Tawfik, the floor is yours.
Thank you. Next slide, please. Thank you. So as Dr. Roldan has said, that we do have a significant increase in prevalence in youth mental illness. In the state of Florida, approximately 1 in 5 or 6 youth are experiencing a mental health disorder. It's doubled from pre-pandemic estimates. We know that we already were in a crisis of youth mental health concerns pre-COVID, and it has at least doubled since then. What's really shocking and sad is that over 204,000 children and adolescents have become orphans or have lost a caretaker in recent years. The American Psychological Association, I don't want to spend too much time with statistics. Dr. Roldan did a great job of covering that, but I do want to note that there was a practitioner impact survey that was done just this year. And as you can see, there's been an increase in almost all disorders that have been treated. There's been an 80% increase in anxiety disorders this year, 66% in depressive disorders, and trauma, 64%. And a very significant increase in substance-related and addictive disorders. Next slide, please. There also has been an increase in the demographics. So 38% in children under 13 have needed mental health services, 46% increase in adolescents, 13 through 17. And then in emerging adults, our college level students, there's been a 40% increase. Next slide. The emergency department visits that are related only to mental health has increased significantly. In our hospital at Nicholas Children, it's increased by 68%. Nationally, there's been a 24% increase for children ages 5 to 11. So 5-year-olds going to the ED for mental health visits. 31% for those ages 12 to 17. And what's really shocking and concerning is that there's been suicide attempts increased by 51% in adolescent girls. Next slide. We've already spoke about that, so we can skip that slide. So who are at greatest risk for mental health difficulties? We already saw that the ED visits have increased by 51% in adolescent girls. Adolescents in general are at higher risk. We know that that's a very difficult time for children who are experiencing a lot of changes physically and mentally. And I know we don't want to focus so much on COVID. However, the semi-post-COVID time of isolation especially in adolescents has been really detrimental to their mental health. We also have sexual and gender minority youth who are at greatest risk. We know that in a recent survey, youth who were considered LGBTQ, 73% reported experiencing anxiety and 45% reported seriously considering attempting suicide. Our students of color as well are at greatest risk for mental health difficulties. Our learning disabled in schools and special need children are at great risk. Also, low income and children of immigrant families are at risk. We know that poor mental health has a negative impact on school performance. And there has been not only an increase in demand for therapy, but also an increase in demand for psychoeducational testing due to academic difficulties. A recent survey showed that parents are incredibly concerned about their children in school and note that they have fallen behind academically. I don't want to spend too much time on this slide, but I do want everyone to understand that, a lot of these disorders co-occur. So it's very rare that one child will have an attention deficit hyperactivity disorder alone without experiencing anxiety, without experiencing depression. And really ADHD, anxiety, and depression are the most commonly diagnosed disorders in children, along with trauma right now. Next slide. And these disorders occur with learning disabilities as well. We know that a recent study showed that the National Assessment of Educational Progress test, which is a gold standard, showed a significant decrease in reading and math among our children. For the first time since the 1970s, so for 30 years ago, 9-year-olds who are about third graders declined in their math and reading scores, and that occurred almost across all income levels and ethnicity and race. It was worse for lower performing students. However, what's concerning is that higher performing students also had a decline. The math scores for both fourth graders and eighth graders, and this is something that came out just recently in October of 2022 with the same assessment, fell in nearly every state. Only 26% of eighth graders and 36% of fourth graders were noted as being proficient in math. And the reading scores also declined in more than half of the states nationally. The biggest decline were in students with disabilities who needed specific individualized education plans, those that are special needs, the English as a second language students, and also those that are underserved and low income students. Why do we care about test scores and their impact? Well, we know that academic performance and mental health go hand in hand. We know mental health is declining among our youth, and therefore academic performance has been a struggle for many of them. We know that test scores are predictive of how students will perform and succeed in school. And if students do not succeed in school, whether it's for socio-emotional concerns or academic concerns, they will have disengagement, and disengagement leads to early dropout. There's a recent study from the CDC that showed that youth who felt connected to adults and peers at school were less likely to have feelings of sadness or hopelessness, to seriously consider attempting suicide or to attempt suicide. So it's very important that we try to engage our youth in school. So in light of everything that's been going on with our children, our youth, and the world in general, we know that this has had an incredible impact on the workforce. There's a shortage of psychologists, of therapists, of tutors that can help our children. There's a shortage of teachers, and there is significant parental burnout. There's been a lot of studies showing that parents are in need of help and services to help their children. There's also a shortage of healthcare workers, and we know that primary caregivers are at higher risk for anxiety and depression than non-caregiver groups. Next slide. So there's a trickle-down effect. You know, the parent caregiver behaviors can be transmitted to youth that reinforces anxiety, and studies have shown that caregiver stress can have a direct impact on children's mental health. We also know that there's an increase after natural disasters, and we can, the pandemic is a natural disaster. There's an increase in family violence, there's an increase in domestic violence, and there is an increase in child abuse. And we have been seeing that in the front lines, a lot of child abuse, a lot of trauma that has been, that have been seeking treatment with us. Next slide. So how do we help strengthen our youth's mental health? We need to strengthen community-based mental health services. We need to expand our training and grow pediatric mental and behavioral health workforce. We also try to, we want to try by strengthening our mental health centers, we can prevent and have early identification and treatment, which is obviously most successful. We also want to do some school-based interventions that can help, and we want to try to increase our integrated care teams and work with primary care physicians. At Nicholas Children's, we have over 21 clinics addressing chronic conditions. We know there's a better outcome when we have psychological support, working alongside our primary care physicians. We have a number of clinics addressing the needs of those in our community and as well as, media and presentations and other activities to help those that are in the front lines in our community help our children. Thank you.
Thank you so much, Dr. Tawfik. As you all have been able to experience, we have two great experts this morning with very, very important information across all age groups. So if I would ask Dr. Roth to please come back on, and I will start the Q&A. So much to ask, but we will start actually narrowing so that we can assist and have the participants that are here with us this morning to feel free to ask questions. So first, I will start with Dr. Tawfik. How do you relay coping tools, coping mechanisms, especially for the parents? As we know, I always say that our colleagues, the pediatricians, they treat more the parents and they treat the children. So parents become very much aware and scared when they see certain behaviors either change in very young ones, or as you alluded to, Dr. Tawfik, with the adolescents, it's a very, very challenging time as it is. And with everything that has happened in our world, and, again, with social media, with all the impacts that our adolescents are facing, how do you assist the parents to navigate those challenging times?
That's a great question. I think there's so many different ways that we can help our families, help our children. The one thing is, that we always ask the parents to do is to listen to their child and observe their child. If they see their child withdrawing, any changes in behavior with sleeping, with eating, either eating too much, eating not enough, sleeping too much, having disturbed sleep, grades dropping, lack of concentration, they need to be seen by someone. So seeking services is the number one thing that we ask parents. Now, in terms of burnout, which is a little different, parental burnout, what do? We know that there's that trickle-down effect, right? So parents need to take care of themselves. There has to be self-care. There's a number of different things that they can do that once they cope with themselves, they can help their children in a better way. So there's two different things: seeking help for their child and making sure that they have open communication with their child and the schools, seeking help with therapists, community-based centers, but also helping themselves. And depending on what the problem is, there needs to be a routine, consistency, structure that always helps children. And I think that's one thing that was lacking during COVID, is the lack of routine and structure and consistency.
Thank you very much, Dr. Roth. I'm going to go back to something that is very important, especially in today's time when we find family structures being disruptive, being dysfunctional, so to speak. Both parents working. We don't have any more in some of our household. We don't have the grandparents that are available. They could be at a home. So, being that family structure is so important to support that loneliness and to support that fear of what has happened with our youth and prevent suicidal. How do you work through this with families?
Well, Dr. Roldan, as you have well pointed out, family unit is one of the things that was disrupted by the coronavirus pandemic. Many grandparents or even parents were sometimes immunosuppressed because they had medical conditions and couldn't really be exposed to other people because they were more vulnerable to get sick. And this is isolated families. Fortunately, on the other hand, modern telecommunications have created a bridge through Zoom, and our lives have been completely transformed, even in the way that we practice in our work every day, in terms of telecommunication. So it's not the same, but it's a little bit better than nothing to communicate, to try to maintain a connection with the person that is absent and take advantage of these new technologies of telecommunication.
Thank you for that. I'm going to go back to you, Dr. Roth, and I'm going to basically focus on your areas of expertise for many, many years, which is the refugees and immigrant population and the stresses and challenges that they go through. We have lately seen and all read that there has been a great, again, exodus from the island of Cuba, as well as other countries, Haiti, etc. And on top of that, all the challenges that this country is facing with what has happened for the past 2 years, and economic challenges, et cetera, et cetera. Can you help us kind of understand all that impact of having these populations come and what they're feeling, right? What they're feeling coming, leaving their country, going through those strenuous time, and then coming to a country that in itself, we're still being impacted by everything that we have gone through in the past 2 years.
Well, that's a very important question. And for every immigrant, and it doesn't have to be from one country to another, sometimes immigrating within the United States, if one community is very different from another, individuals go through two major changes. One has to do with mourning of attachments, who was left behind. And what was left behind is often not only human connections, but the child's school, the child's neighborhood, the bodega, the grocery store around the corner where you socialized with the members of your community, the loss of the non-human and the human environment, and the encounter with a completely different environment. That's on the part of attachments. And then the other thing that happens to the immigrant is the loss of identity and the transformation of the identity. The person goes from usually a society where they felt very competent, where they were valued, where they had a position in the hierarchy, to being demoted. And if there's a change in language, the individual is demoted to the level of a 2 or 3 year old who is learning to speak, because the person can't even communicate in the language of the host culture. So it's a tremendous emotional stress to immigrate. And it also has a lot to do with what kind of social capital the immigrant brings. It's not the same to immigrate when you have a college education that can be revalidated in the host country than when you have a college education in your home country, and then you get demoted to the level of a janitor or a cleaning person in the host country. So all these things have to be taken into account. It's a tremendous, it's not for everyone to immigrate. You have to be very strong and very motivated.
Absolutely. Thank you for that. And obviously a place like Miami is seeing that impact. And it's not only the state of Florida, but other states across, because we have the immigration from the Caribbean right here at home, but then we have immigration on the west side of the US, as we know. So great impact. Dr. Tawfik, in kind of leading to the education piece. Education is very close to my heart, and I feel that, as professionals, we're lifelong learners, and therefore educational is also the essence, not only family structure, like we have said, on the emotional and socio-emotional side, but on the educational side, very important to know that our future is going to be led by very strong mentally and social and what is it, spiritual. I mean, everything we know as health, right? Generation. So what have you been able to work with some teachers, maybe in Miami-Dade County? This is very, I mean, the issue with the reading and math sliding is very, I mean, I'm very worried. I am a grandmother, you know, and I have my grandkids, you know. I just didn't leave just because my children are adults, but I do follow my grandkids' education, and it's very worrisome. So what are the things that, if you are working with some of the Miami-Dade County teachers, what are the things that they're doing right now in order to, I would say, to try to assist this for next year's test, that we can go up again in the scores that we were seeing pre-pandemic?
You know, I think this isn't it's not an easy fix. I don't think it's going to happen within a year. I think, you know, we're really talking more about a couple of years of learning gaps that have occurred. If we think about, you know, if we think about the last 2 years, there's been a number of schools and students who have really been under virtual instruction. And we know that virtual instruction is not for all children. Those who have learning disabilities, who are in an individualized education plan, an IEP, or a 504, which is for other health impaired children, they get special services. They get small instruction, they get extended time. There's a lot of accommodations that are given to these children in learning English as a second language. They're in smaller groups. So these are things that did not occur, they were not able to occur in the last few years for many. And so this is something that it's more like a gap that's going to take some time to remedy. We know that children with attention problems are not good at looking at the computer and learning through the computer. Now, I know they love video games, and that's a different thing. They get stimulated with that, but in learning, it is a difficult time. So, you know, the teachers are doing their best. You know, I do speak to teachers. I do test a lot of children. I do a lot of psychoeducational assessments. I have a number of second graders, third graders coming to me. And just before I start testing them, the first thing they tell me is, I can't read. So they already know that they're having difficulties, and that's why they're there to see me. So the teachers are doing their best. You know, we do have a shortage of teachers. So they are stretched and they're doing their best, but they are right now trying to do a lot of small group instruction now in person, which can help the children who are struggling. We have tutors that are also attempting to, you know, to help kind of close the gap, even though, you know, there is a shortage, but we do have tutors that are also trying to help close the gap. But I think this is something that's going to take a few years. Unfortunately, it's not an easy fix, because the foundation has to be there. And if the foundation for reading, for example, was not there, we can't just skip right over it. We have to start all over again in a way and reteach some of these things.
Correct. Thank you for that. It is very not frightening, but it's concerning. It's concerning. And as you said, it's going to be a buildup for every year. We might add a few more years in order to start building that foundation again. This question is for both of you. I don't want to put you on the spot, but you know, it's we're going through a lot on workforce, right? You know, across every discipline, industry, we're seeing that where are the employees, you know, and employees are burned out because one employee may be doing several things for other employees that now we don't have. So I want to kind of, for both of you to touch upon that. And the second question to that is, because of lack of time, and I've seen this lately, there's been a lot of media and advertising on those self-help websites, which to me as a physician is concerning. You know, we know that telehealth has been a means of reach and access. However, you know, when it comes to mental health and medication management, I don't need to say this to both of you, it's very concerning. So some of this individuals that are at the workforce may be accessing those websites because they don't have the time, to maybe go to see Dr. Roth or maybe take their children to see you. So 2 questions in one. So I don't know who would like to start. One is the workforce impact, and the second one, what do you think of those self-help websites?
Dr. Tufik, ladies first.
Thank you. Well, I can comment on the self-help websites. It's easy for, of course we know that, telehealth is the easiest mean of getting help, right? It's, you just sit there, you log on, and I think my advice on that is we want to make sure that we know that evidence-based treatment, like cognitive behavioral therapy, dialectical behavior therapy, ACT, there's certain treatments that work. There's a lot of research out there that shows that these evidence-based treatments work for certain things, especially for anxiety. We know anxiety is, skyrocketed, and that's one of the main things. Depression as well, trauma-informed CBT treatment. So telehealth works for some people. However, the main thing for me in terms of these self-help places that are advertising, are they using evidence-based treatment? Do they have licensed therapists, licensed psychologists? Those are all things that we need to ask. Are they seeing you for 10 minutes and giving you advice, or are they using the normal 50-minute therapy session? So those are all things, I think we just need to educate ourselves, because I can't really comment on one particular one, but we do need to educate ourselves and make sure, that we are getting the treatment that we deserve. If you go to a hospital and you see a physician who went to medical school for 1 year and is not licensed, you're not going to see that person again. So we want to do the same thing for mental health and the people that are advertising out there. Do they have licensed psychologists or licensed therapists? What training do they have? And are they using evidence-based treatment? That is obviously what we would like you to receive.
Very, very important. Dr. Roth?
Yes, I would like to add something that's very important to our lives, which I mentioned briefly, which is the process of mourning. Mourning is the mechanism that nature has given us so that when we lose somebody important or something important, we can get up and keep on living and continue with our lives. And the process of mourning is usually involves hoping that the past will come back. So our lives have been changed by the pandemic. And one of the typical feelings of mourning is sadness. So it's very normal to feel sad, to long for things that are no longer there, that were lost. And that's part of the adaptation to the new reality. So in order to adapt to a new reality, we slowly let go of the past reality that is no longer there. And there's a mourning, there's a sense of loss, sadness, contemplation, and so on. So the fact that we all feel a little bit sad, a little bit nostalgic about something that was and no longer is part of the human condition. It's part of our daily lives where we have to change and we have to leave things behind and move into new environments, which always requires the stress of adaptation.
Sorry, thank you for that. I guess you answered my question. I'm going to throw something funny, and this is on a personal basis. I love Hallmark movies, especially during Christmas, and it just makes me happy. And it is true. The ones I've seen this year, I mean, they're so happy, but I even kind of have a tear sometimes, something emotional, that I see. And I said, whoops, that's not me, but maybe it's because so much has happened. And on a personal basis, I have lost friends, colleagues, during the COVID pandemic. And, life goes on and there's a lot of changes that we're seeing. So I thought it was my aging. As you become older, you become more emotional, but I think it's normal. So thank you for that, Dr. Roth. Okay, at this time, I am going to call on my partner, Dr. Stewart. I know we have a few questions on the Q&A. Dr. Stewart?
Yes, we do. Thank you.
Yes,
Let
great.
me get the technology going. We have some really good questions here. Let's start with this first one. And either of you, and great job, both of you. Awesome work so far. In children and teenagers, what is the clinical threshold to put a patient on medication?
Well, I guess I should take that one. My rule of thumb, or the rule of thumb about medication, is first you do talking therapy. And if talking therapy doesn't work, then you have to take the second rule of thumb, which is if there is impairment in functioning. And impairment in functioning can affect three areas. In the case of a child, school; in the case of an adult, work. So school or work, home or social. So if the child is failing in school or the adult is failing at work, if they're causing problems at home because they're not participating, they're too irritable, too melancholic, or socially they become isolated, people are getting annoyed with them, and they can't control that, that's an impairment in functioning. So first you try a verbal psychotherapeutic intervention, and then if the impairment of functioning continues, then you consider medication.
Thank you. Very nice. What can employees do to help employees that are dependent and are recovering from trauma? Let me ask it again. I kind of stumbled there. What can employers do to help employees that have dependents who are recovering from a trauma? Either one want to take that?
That's a little bit difficult, I think. I think, the flexibility of the employer, while the employee, is dealing with this difficulty, might be important. But I think when there is any kind of trauma, there always needs some intervention that is required. So
Thank you for that. Here's another question. If a parent and child are both struggling, do you recommend a therapist that can treat both, or should they find one that can treat individually?
that's a very good question. If Dr. Roth, if you don't mind, I can
Please.
take a stab at this. I think a good child psychologist works with the parent. So, the child is not seen, it takes a village to help the child. So the child is not seen in vacuum. However, if the parent is struggling significantly, where the parent cannot function on a daily basis, and needs help, then absolutely the parent would need to be seen by an adult therapist, adult psychologist, to help them. But if both of them are being seen in therapy, especially the child, the parent always needs to be involved in the child's treatment.
Wonderful. Thank you for that answer.
Dr. Stewart, if I may, I'm so sorry to interrupt.
Absolutely.
I didn't want to get away from on the previous question, by the way, because it's something that is concerning at the level of the workforce with employees. I know, for instance, at FIU, we've got a very good Department of Employee Assistance. And I believe, that's also probably at the level of the hospitals. Dr. Stewart, you probably at MDC, but we do have a very, very good, which, by the way, they are working overtime, but they, employees are free to go, and they have mental health counselors if they are going through any, and it's completely, by the way, it's completely anonymous. So that is one thing that, that I know that large employers and even possibly small employers can offer. So I just wanted to touch on that point. Sorry for the
No,
interruption.
that's a great thing. And you're right. We do it at Miami-Dade College for faculty and students and everyone. There's a lot of support now for that. So that's a great thing. Here's kind of a question that I think will impact a lot of people. Are there studies on the impact of social media on mental health, both for children and adults? I think that's a really kind of appropriate question with where we are today.
Oh, yes, absolutely. The problem is that some of the data that comes out is somewhat vague, because these are very difficult studies to conduct, because they're, in order to standardize what kind of message the mass population gets is very difficult, because everybody gets a different message. However, let me just share a personal anecdote. My wife is an elementary school director, and when our children were young, our community center in the neighborhood had some videos that any kid could go in and connect to. My wife realized that the company that was making those videos was the same company that made videos for the military to teach soldiers how to kill without hesitation. And they were using the same technology. So my wife went and complained to the director of the community health center, the community center, and the director was like, well, I don't see the problem, because, this is what we get, and so on. So in other words, there's a lot of invitation to acting out in violence in the media that's not very well monitored. However, where to draw the line gets a little bit tricky.
Thank you for that, Dr. Ross. Dr. Tafik, any response? I thought you might.
I do. I agree. I think we do need to, limit our screen time with some children, and social media. The messages that are being given, especially to our adolescent girls, I believe is very concerning. I don't have evidence right now or a study that comes to mind, but I do see a lot of adolescent girls in therapy that are comparing themselves to a lot of what they see on social media. So that is concerning.
Thank you. And thank you for all the great questions we're getting. Here's a question. It's a little bit off topic. Do you believe that the past 2 years have also affected our young professionals in job etiquette? Anybody want to take that?
I'm sorry, can you say that again? I didn't hear the last.
Yeah. The question is relating to what's occurred the last couple of years and how it's affected young professionals coming into the workforce in terms of job etiquette. How has that impacted how they perform in the workplace and that kind of thing?
Having young professionals at home, I don't know if it's the last 2 years. I think the last 2 years have definitely impacted all of us in terms of, it's not bad to be at home and do virtual, work at home. But I think it's beyond the last 2 years. I think a lot of things have impacted the young professionals. I think the last 2 years in terms of, political unrest, social unrest, all of that, I think has impacted also how we view the world in general. And I think that's part of what has occurred. I think etiquette, though, is more in I think generational gaps. I think I don't know if I want to blame the last 2 years to that, because if I work with younger professionals, and sometimes they view things a little differently than I did, or that I do. And as a young professional, I wouldn't have done many things that young professionals are doing now, just because I think society and the culture that we kind of grew up in. So I'm not sure if I want to blame the last 2 years, but I don't know, Dr. Roth, if you
well, I think Dr. Roldan would agree about how many times when we're teaching a class at FIU, we have to tell our students to close their laptop screens or their phones when they're shopping on Amazon as we are teaching a class. And so the world has changed, and social media sometimes really intrudes into professionalism. Professionalism has definitely changed.
Thank you for those thoughtful responses. You both have kind of touched on this one, but let me see if you want to elaborate. As described in terms of student performance, schools have been severely impacted by the pandemic. What can they do to promote the recovery of not only staff, but also students?
I had mentioned a little bit about some of the things that can be done. I think right now more than ever, we do need a lot of school-based mental health interventions, whether it's with staff or students. We know that, as mental health improves, a lot of times school performance improves. So I think that's really important, making sure that we have mental health help within the schools. I think that's a big factor. I also think, it's not really so much the school itself, but making sure that teachers are, I go out and do give workshops in the schools on learning disabilities and what are the early kind of warning signs, or what are the early signs that we look for in children that have learning issues or mental health issues. And it would be nice to continue that kind of prevention and early intervention to help the students. I think for staff, it's just like I said, I think just school-based interventions, speaking to the teachers who are also have gone through trauma themselves.
Thank you. Our next question is from a provider for mental health services. And their question is related to tragic events like type 1 traumas, first responder type 2 traumas. They find people knowing that they need help, but are reluctant to engage to get that help. What do you find is the best way to bridge that gap between the services available and the and the need of the individual?
That's a very good question. And following up on Dr. Taufik's comments, the American Psychiatric Association has changed its approach by incorporating psychiatry into primary care. So the new trend is not to keep the psychiatrist or the mental health professional isolated where the individual has to go look for them, but to bring the mental health professional to the general medicine or pediatric clinic and schools. During 15 years of my early career, I was the medical director for our school consultation program through the Bertha Abbas Foundation. We covered 54 schools from all the way in Palm Beach County to Monroe, and the funding got cut in the late 1990s, and all those programs were closed. And it was a wonderful program where the mental health services were taken to the school. And now we're reinventing the wheel and going back to where we were 15, 20 years ago.
And if I can add to what Dr. Roth said, there's there was a recent recommendation in terms of primary care physicians screening all children 8 and above for anxiety disorders, as well as continuing to screen those that are 12 and up for depression. And this is occurring in the primary care facility. And, we hope a lot of times first responders may go to their physicians before they go to mental health. And so we hope that these primary care physicians can also help adults and screen for anxiety and depression there. A lot of times we know that adults sometimes listen more to their primary care physician before they seek treatment with a psychiatrist or a psychologist. So hopefully educating, the primary care physicians that work with adults and first responders and would be really important.
Thank you for both of you to that response. How are challenges faced by immigrants from other countries different from those challenges faced by those, say, from Cuba?
Well, there's a whole literature about the differences between exile and financial immigration. The exile is somebody who's expelled, who has no choice, who has to leave by force. And what it engenders is an unfinished mourning process. The person cannot give up something that they haven't voluntarily given up. They were forced to give it up. So that creates a completely different dynamic. However, in Cuba right now, it's a combination because many people are leaving because life is intolerable in terms of the loss of civil liberties, but it's also intolerable from a financial point of view. And is that any different from other countries in Central America or the Middle East or North Africa and so on? So if you go to Europe these days, especially the countries in Southern Europe, they're being flooded by immigrants that are fleeing their countries for both reasons, for political and economic reasons. The differences are that Cubans traditionally were exiles from the Cold War and received a very welcoming reception in the United States, and some of that is still present. But then we get into more the area of politics, which is probably something we should avoid.
Very good, thank you. Dr. Tafik, any comments?
No comment.
Okay. Our last question that I have, what do you think the effect of ERG, the employment resource groups, are for those in the workforce that deal with various mental health challenges, and how can they become more useful? More specifically, a mental health ERG that creates a supportive environment.
Yeah, that would be the employee relations departments.
Right, we talked about that.
Yeah, we talked about that as a source, as probably the opening the door, right, of an employee saying, I'm burned out, I'm feeling, probably that will be the first. So the question comes in, the question is specifically, Dr. Stewart, that what role they play, or?
Right. I think they're asking, can they play a larger role maybe in this process?
Well, if I may make a comment that's peripheral, but I think it's connected, which is that, as I mentioned before, solitude, being alone, is not a natural state for human beings. Our brains are wired to be in dialogue and connection with other people. And I am sure that most of us, or a lot of us, feel energized when we go back into the workplace because we're seeing people, connecting, getting new ideas, new stimulation. So how could an employee assistance program help? By creating community activities for their employees that foster reconnection. We've been isolated. Isolation creates a kind of low-grade sadness. When people are put in prison, what they feel is this low-grade sadness, and it's caused by the social isolation. When we connect with other people, we get happy, we get energized. So being reincorporating into our work community is very important.
Thank you for that. Dr. Rodan, back to you.
Yes, thank you so much, Dr. Bryan. Well, Dr. Stewart. So first of all, thank you. Thank you so much, Dr. Tafik and Dr. Roth for being here today. I mean, you bring a wealth of experience and knowledge in this very, very important topic. However, we all know that there's still much to do. We need to be able to count on resources. We need to be able to count on the government, on politics and guidelines and actually resources, dollars. We all know that unfortunately mental health services are the first ones to be cut. Because going back to what we were saying, what about evidence-based? People don't understand it. However, one thing we did not bring up, and it's very important, is the stigma, especially with professionals. They don't want to seek help because they feel that that's a sign of weakness. And I think that after 2 years of such an impact in our lives, in our families, in everything that we have seen, and to your point, Dr. Tawfik, this goes way before COVID. Mental health disorders did not begin with COVID. It is extremely important for us to understand that there are resources. We should have more, but there are resources. And when we feel sadness, when we feel that something is different in us, we need to reach out. And there's no greater time to reach out. Reach out to friends. Maybe we don't want to reach out to families. Families also sometimes are in a state of denial, and we've seen that as well. But we need to be able to reach out, and to reach out to those resources that, have the education, have the experience, have the background to really guide us towards health. I want to end, before I pass it on to Dr. Stewart to end this webinar, that there is no health without mental health. We say that the body is an entire thing, right? We need spirituality, we need society, we need friends, we need families. Even a good conflict is good because it is a conflict that we're dealing with someone else. And we all know as physicians that there are certain hormones in our bodies that are positive when we are around loved ones, and also there's hormones that go when we are around people we don't like, but that just shows that we are human. So in closing, I want to wish everyone a very, very happy holidays. Holidays is a time for a lot of thinking, a lot of pondering, but also wake up every day with gratitude. Gratitude also fulfills that part of us as humans that, we've got one more day. And every day is a gift. So I want to thank you for today. And I'm going to pass it on to my partner, Dr. Stewart. Happy holidays to everyone.
Thank you. Thank you, Dr. Rodon, for doing a wonderful job leading this. Thank you to our two guests, Dr. Roth and Dr. Tawfik. Thank you so much for being a part of this. To all the people that have participated in this in the chamber, thank you for your support. Everyone have a safe and healthy holidays, and hopefully we'll see you back in the new year. Have a great day.